People usually recover from coronavirus disease within 2 weeks of illness, but in some cases, COVID-19 can cause symptoms that last weeks or months after the infection has gone. These cases have different names and are called a post-COVID-19 syndrome, long COVID, or chronic COVID. CDC considers these cases when symptoms still exist 4 weeks after the initial infection. Certain risk factors increase the odds of severe COVID illness, but there is no clear link between these risk factors and long-term problems. Patients who required hospitalization or ICU admission during their COVID illness are more likely to develop long COVID. The Office of National Statistics in the United Kingdom found that 21% of people who tested positive for COVID-19 experienced signs 5 weeks after the initial infection. Long COVID is a broad name for about 207 signs and symptoms more than 4 weeks after the initial infection. The combination of symptoms can be new or ongoing. According to the CDC, the most common lasting symptoms are fatigue, shortness of breath, cough, joint pain, and chest pain. Other less common issues include muscle pain, migraine like headaches, rapid heartbeat, returning fever, cognitive problems, and difficulty concentrating. COVID can result from damage to the lungs, heart, nervous system, kidneys, liver, or other organs. Severe COVID-19 cases can lead to scarring and other permanent problems in the lungs, which accounts for persistent shortness of breath for low-intensity activities. Such cases may lead to oxygen supply dependence. In more severe cases, the patient may develop post-COVID pulmonary fibrosis. Early reports show the possibility of full recovery for the lungs within a few months of proper rehabilitation and treatment. Heart problems are not rare for an ongoing SARS-CoV-2 infection, including myocarditis and heart muscle inflammation. One study showed that 60% of people who recovered from COVID-19 had signs of ongoing heart inflammation. Other patients had unexplained persistent palpitation and rapid heart rate. Severe COVID-19 is associated with vessels damage and blood clots. After surviving COVID-19, some people are left with anxiety, depression, and other mental health issues. Multiple factors play out in this category of complications. Up to 50% of people who spent 1 week or more in ICU developed mental health problems and ICU-related PTSD. Physical changes such as pain and weakness can lead to self-isolation, decreased productivity, and financial challenges. Anxiety, mood disorder, and sleep difficulties were present in approximately 1/4 of patients in the post-acute COVID-19 Chinese study at 6 months follow-up. Children also have their share of the long COVID. Many cases of multi-organ disease have been recorded. It is called a multi-system inflammatory syndrome. It hits mainly people below 21 years old. It manifests with a broad range of signs and symptoms since it can hit any organ in the body. It is not a common occurrence but can lead to a bad prognosis. Relatively new conditions like this are still not fully explained yet. The CDC published that they are working on trying to understand this condition. Given the limited history of the pandemic, it is too early to know how long chronic COVID can last. Some signs and symptoms like loss of smell are fully recovered within the first couple of months. The best way to avoid post-COVID-19 complications is to prevent getting infected with SARS-CoV-2, the virus responsible of coronavirus disease. Practicing coronavirus precautions and getting a COVID-19 vaccine when it is available to you may help to avoid getting COVID-19. Thank you for joining us for another video covering key health-related topics by Medicalarts Official. If you have any questions, please leave it below. Subscribe to support our channel, like and share with your friend.